we have Paula Frerichs. She is a regional manager at Nightlight Pediatric Urgent Care in Florida. She's got some really great insight on how they've kind of gotten telemedicine started. There are several locations in Florida. So Angie and Paula are going to lead you through some great content about patient access today.
Thank you, Tencel. So just the first thing I would love to start with is, hey, everybody, give yourself a pat on the back. It's been a long 2 years. This is a practice manager webinar. Paula's smiling too. It has been a long 2 years for you guys. Great job. For the clinicians that have joined too, I know how hard you guys have worked and how hard practices have worked to really, in an unprecedented time, really meet the needs of patients and families. And that's kind of what led us to today's webinar, which is, boy, nothing was consistent over the last 2 years. But one thing that we all wonder is telemedicine here to stay? I talk to practices every day, and I hear a lot of my patients don't want it. But what's really interesting is we did a survey of people who have used telehealth, and really over 50% of those parents, they want telehealth. So when I always get a chuckle when I hear from practices that say, gosh, my parents said, my patients don't want to do telehealth. They really do. And so if we're thinking that they don't, we're really missing an opportunity for our practices. So what else we learned on this survey, because, we love to hear what parents have to say is, overwhelmingly, they are all getting, those visits with you as that primary care provided are covered by their insurance company. Payment obviously is one of the most important things. It's, when payment happened with COVID, it's one of the things that really grew telehealth, because the clinicians need to be paid for their time. And what we all probably imagined and know is convenience is that number one benefit, right? Families are going to the places that are most convenient for them, right? They're stopping into Kroger's, and while they're there, they're getting their flu shot or having their kids' ears checked out because it's convenient. They're already at Kroger's buying their groceries. So really, it's always nice to do the surveys and understand what we hear from practices and what parents are saying sometimes aren't always connected. And the next slide I really added because I think it's really interesting. I think this is something that we as pediatric practices have to stop and look at this data. So if you look at that middle section of live video calls in 2020, overwhelmingly 70% were offered by the doctor or clinician and were completed. But if you look into 2021, that is dropped, and the services that have grown are the people that aren't necessarily driving patients to your practice. The service offered by an employer, the service that's offered by their insurance company. So I think really the point to think about here is parents and patients want it. They're going to get it somewhere. They better be getting it from you. Right? Because if they don't, they're going to go somewhere else. So I think I just found this such a great study, because it really said that, when the clinicians weren't doing it and offering it, or if they weren't proactively offering it, someone else is going to take that revenue from your practice. So why offer telemedicine? Because if you don't, someone else will. Right? I mean, we all learned how to use it. I'm a consumer myself. When I need to see certain clinicians, I will only do a telehealth visit. If you're going to make me drive into the office and wait for 30 minutes and then, I'm not going to do it. So if you don't, someone else will get your patient that way. And I think the other part is studies have said that going forward, telehealth and telemedicine is going to be 20% or more of your practice revenue. So if you're not offering it and someone else is, you're watching revenue leave your practice. And that's really important for every practice. So I think, our topic today is efficiencies. And as I really spent some time thinking about this, I always think efficiencies have to really start at how does your practice work, right? Because, we'll have people on the call today, and somebody might be from a small practice, others are from a large group. But you really have to think, if you want to be efficient in anything you do and in your telehealth workflows, you have to think about what works well for your practice. A practice that has, 4 patient reps working every day is different than a practice that has one person doing all those jobs. So as you're thinking about efficiencies and you're thinking about telehealth, I would challenge you to think about some of the roles that are going to interact with your telehealth, right? Who's going to answer your phones? Is that your front desk? Is it someone committed strictly to answering the phone? Is it a triage nurse, right? All of those could drive different ways to address telehealth. Who's the person that checks the patient in? Is it a front desk person? Is it an MA? And also, who is taking that patient when they're done at the end of their visit? So who's scheduling that follow-up appointment? Is that someone who's talking about telehealth? Or does the doctor say, hey, at the end of the visit, let me schedule your next appointment? Really, what is your staffing working, and what do they do, and where would that fit into your workflow? The other thing to think about, and I think everybody on this call has thought about, is your clinician, right? If they are frightened of technology or was something they were never comfortable with, that's going to make a big difference as to maybe how your workflows are, right? Do you need to have other staff members involved getting a patient into a telehealth visit? Or do you need additional training? What do you need to do? But really thinking about those clinicians, I can tell you over the last 2 years, I've really learned that any clinician can do telehealth. It's really a desire over a skill, but really helping them overcome some of their comfort level with technology. And I think the other thing is where and how do they like to work? We have clinicians I know that use their smartphone in an exam room to do a telehealth visit. We have other clinicians that like to be in their office and behind a big screen. We have clinicians that like to leave work early and go home and do behavioral health visits in the afternoon via telehealth. But really thinking about how does your practice work, at optimal efficiency? How does your practice work that really makes a great environment and people are happy and positive? Those are all things to think about your practice workflow and kind of how do you integrate telehealth and successful telehealth workflows into that. So practice efficiency, the first place that telehealth, we've done a lot of, especially over the last 60 to 90 days, is sick visits, right? So how can I take a sick visit and help my workflow within my practice be more efficient? So, a great way to do that is a patient's called in for a sick visit this morning. It's something that we've identified through the front desk, our triage, even our protocols within the practice that can be telehealth. A rash is a perfect example, right? Parent calls in, my child's got pink eye, my child has rash. Instead of having them come in and take all that office staff, why not book that in where you've had a cancellation later in the day for telehealth? Great way to fill that doctor's schedule to minimize the use of your staff, right? So pink eye, they don't need to be checked in by the front desk. You don't need to clean the practice waiting room, the practice exam room, and you can do a simple telehealth visit. The other way to think about an efficiency for a sick visit is a parent calls in with that symptom. That can be treated via telehealth and a provider is available. It's, maybe 10 minutes before you go back into your afternoon schedule and that a provider is available to do that. Send them a link, get them into a visit, and you've just had an instant invite or a very immediate telehealth visit. And then the third way to really think about those sick visits is to allow those virtual walk-ins. Now, we have some practices that love virtual walk-ins. They are open all day long for patients to come in and request an appointment, and their patients are trained for that behavior and they love it. We have other practices due to staffing, due to clinician preferences, are like, that's way too much for me. Well, limit those hours, make it first thing in the morning, make it an hour after lunch, at the end of the day, right? You don't have to be open all day for walk-ins. You probably aren't in your practice. So you don't necessarily have to be open for virtual walk-ins all day long. So I challenge you to think about how can I take telehealth and make it something that works within my current workflows and helps me meet some of the challenges that I have to manage with scheduling. Anybody on the call who's a practice manager deals with schedules all day and thinks about, how do I keep it full? How do I make my clinicians happy and my patients happy at the same time? And telehealth is a great way to do that. Scheduled visits, really what can I do via scheduled visits for telehealth that's going to, one, ease my provider schedules. So we all know some clinicians are very particular about their schedule, right? They like it a certain way. Will help ease those schedules with the telehealth visits, right? Use your telehealth visits to maybe work within their workflows. A great way is if you do any type of phone call from lab follow-ups, then there are so many back and forth between the provider and the patient, right? Mom calls to get the lab follow-up, the provider's not available, they call mom back. A great way to do that is when they're leaving that appointment and you know there's a lab follow-up, schedule a visit. Do a 10-minute or a 15-minute telehealth visit. It's a billable visit because you've done a visit with the provider and the patient, and it's scheduled. So it's not 5 back and forth of the phone calls. And really, I think that, scheduled visits are a great way to meet the needs of patients and parents for those behavioral health or mental health follow-ups. When you think about ADHD and a patient comes in, we know a lot of practices that the patient comes in for a visit and they go ahead and schedule those next 2 or 3 visits via telehealth. I can tell you as a mom, I love when my visits are scheduled ahead of time. I can plan my schedule, I can plan my kids' schedule, but going ahead and doing at checkout some of that scheduled visits for mental health and behavioral health really benefits your practice and benefits the parent. Think about it as a practice. If I don't have to call and schedule that, follow-up visit, 2 months down the road, that's a great way to go ahead and create that efficiency when they're checking out. Paula, I'm going to turn it over to you now.
Hi, everybody. Thank you. So one thing with Nightlight Pediatrics, we are a pediatric urgent care. So we're not a scheduled business. We are considered a walk-in. So some of the things we have to do with our schedules for our providers is we have suggested arrival times so that they're not waiting in line outside. During the pandemic, we learned that having a walk-in business is harder because then you have everybody showing up at one time, and that caused a lot of chaos. We didn't have enough tests for everybody. We didn't have enough anything, including staff. So we had to come up with a suggested arrival time opposed to a scheduled business. So part of that came with onboarding our staff, making sure that everybody knew what to do, when to do, and how to do, especially for our telemedicine, because telemedicine at the time was new to us during the COVID pandemic. So we were planning our introduction into telemedicine right prior to COVID, but then COVID came and we expedited that process very fast. So getting our staff on board, learning and understanding what to do with the telemedicine platforms was big. The training on the platform, very simple with Anytime Pediatrics. You did the webinar with them, understood where to click, when to click, and then we did some one-on-one training with the providers to make sure that the providers and the clinicians knew exactly what to click and where to click in order to make that visit that much easier for their patients. It also came with training the parents for us because we see children newborn to 21 years old. So we deal a lot with parents on the telemedicine. So dealing with them, we had to then educate them on how telemedicine works because everybody's like, urgent care, you don't do telemedicine for urgent care, but we do. So we were able to then have the parents understand the concept and then be able to see things such as a rash on telemedicine. You can see anything on telemedicine. We saw everything from people that needed COVID tests. We have what can be assessed via telemedicine and what can be seen on telemedicine. So you're still getting the benefits of using the telemedicine platform for things that need to be assessed with that, which then takes the releases the stress on the actual clinical staff in the offices. So the provider on the telemedicine would then assess the patient, figure out what's going on. And then if they needed a lab test, we tell them, show up at this location, they'll do the lab test for you. It's a nurse visit at the location just to do the swabs and go, or do a urinalysis and they leave. And the telemedicine staff calls back with the results for that rapid test. So although they had to come into the clinic, they weren't seeing the clinic provider because they already started their visit with the telemedicine provider. So that part of it helped a lot. It also helps with our, what we call our gush periods, or this, where the clinics are inundated with our walk-in patients. We were able to take some of those patients and then move them towards our telemedicine. Say, hey, you're being seen for this. It could be seen via telemedicine, but stay close because we'll do the swab for you, but you'll be able to get in and get out a lot faster than waiting those 2 or 3 hours to see the clinic provider. We had a lot of our workflows were different. We had to understand them. Our telemedicine clinical staff and our telemedicine providers had to understand their place and their role within telemedicine and how we can make the business better and what we can do to expand the business into the telemedicine world. It hit our marketing department. It hit every department throughout, our billing department, marketing department, that nobody knew how to deal with telemedicine at the time. But when we came on, it's now seamless. We get our patients in, they get seen, and they're back to going back to school, going back to work, whatever the case may be. One of the things, the benefits that we saw, one of our practices is after every clinical visit or telemedicine visit that we have, the following day, we do a follow-up call. And Angie mentioned some of these practices prior to this slide. So what we do is we call every patient that was seen yesterday. And during that call, if they were an in-clinic patient, we can tell them, hey, did you follow up with your PCP? Oh, if you need to follow up with something from Nightlight, why don't we send you to telemedicine? So we were able to introduce telemedicine and Anytime Pediatrics platform to our patients during their follow-up call, which then made it easier for the patients, because we at Being Urgent Care, we don't have a steady patient in our practice. All of our patients they already have a PCP. We're just borrowing them for the day. And then we send all their records back to their primary. So we were able to do that and let them know that we had the telemedicine available. All of our local PCPs from all of our offices, they know that if they go on vacation, if their office is too busy, we are able to see them until 11, 12 o'clock at night. So that helps our after hours practice. And we can then see telemedicine patients that late. So if the PCPs locally go on vacation or their office is busy, we're always available and ready to help them. So letting your patients know, we share our hours, of course, of when we're available. Our schedules for telemedicine is 2 to 10 during the week and noon to 10 p.m. on the weekends. So we're able to make those times available and schedule a telemedicine visit every 10 to 20 minutes, of course, depending on what they're being seen for. And of course, we give that information to all the local PCPs. So the PCPs know our schedule. They can go online, book a visit, or help their patients book a visit as well. So we really, really like that opportunity where the patients can book, tell us what they need to be seen for ahead of time, and then we can get them in, get them seen. And we have the ability to add more than one provider on the telemedicine schedule if needed. The communication is very, very important between our staff and the patients. So we always want to make sure that once the patient books, we contact them, we get all the information, the vitals, everything that we need, so the telemedicine visit goes as smooth as possible. For the why of this, letting your patients know the common conditions that we treat during our telehealth. On our website, we list things that what you can be seen versus what can be assessed, because you can assess things like the flu. If they have a common cold, you can assess that, but you can't diagnose it until you have that actual test done. So that's why we can assess things like that. Rashes, some of fevers is big, swimmer's ear is big. Those things you can actually see via telemedicine. However, if they do need the test, we can send them to any clinic to make sure that they get seen. The continuity of care, this is a flow process that we use. We make sure that everybody is taken care of. We make sure that everybody knows we're part of their medical home when it comes to the local pediatricians. So we make sure that we follow through with everything. The local pediatricians know what they're seeing, how they were seen, and what they were seen for, what diagnosis they have, and what follow-up care is needed. So being part of their medical home, they can now follow through, and they don't break that, won't get kicked out of their practice. We do avoid last minute cancellations. Unfortunately, some people do cancel last minute, and it's just part of the practice. It happens whether you're a walk-in facility, whether a scheduled facility, it doesn't matter. People cancel just because that's what they want to do. They might have been seen earlier in the day and they forgot to call us and tell us. It happens, but once we know we have that cancellation on the Anytime Pediatrics site, we can then open those slots up to other patients so they can see it. So the long distance, so avoiding the traveling long distance for care and stuff. For me being in Florida, if the patient was an established patient in Florida, we can see them even if they go, let's say, to Missouri, as long as they're an established patient with us. We have to be cautious about who we see via telemedicine out of state. So if they were established with us prior to, they then started that practice, and we can see them. But if they're a new patient, unfortunately, we can't see new patients from out of state. And we keep everybody involved. We make sure that the PCPs know what the child was seen for, when they were seen, how they were seen, and what follow-up is needed. So some of the things we do in our marketing to make sure that our parents, our patients, everybody knows about us. We do email blasts through Constant Contact. We have the ability to do SMS text messages to any of our patients, direct mail letters, webinar Q&As, of course, lots of social media, lots of e-blasts, e-faxes. We're able to do that. We send so much out. In-office messaging, print messaging, phone messages, and greetings. We make sure all of that is done. It's all about letting people know the content, letting them know your services and what you can offer and how you can offer it, even on telemedicine. Some people would be hesitant to use telemedicine for some of the things you would want to see an in-person provider for. And the patient communication, we do the pre-registration. It's on all of our platforms. We do the patient registration, so we know why the patient needs to be seen. We educate the parents on what is available and what's the best way to be seen, whether it's in person or telemedicine. We do some contests with our patients. It could be, tell us, you'll win a gift card if you tell us your best telemedicine experience, and so, or we have pictures of, send us your picture of your child on a telemedicine visit, and the best picture gets nominated, and we can send them, a gift card to something. We make sure we communicate always, and our practice website, we always make sure that listing telemedicine is on there and available with easy walkthrough clicks for everybody.
Thank you, Paula. I can't tell you how much I love what we assess via telemedicine versus what we treat. That's the first time I've heard it described that way. I love that you tell your patients that, tell the parents that, because I think that's one thing we've really learned in the last 2 years is it's a great tool for assessment. And if parents know that that assessment is part of it, and it may not be the total visit, they're going to be really excited for that. So loved that. Just wanted to throw that in there before I went on to this, because I think that really almost expands what we're looking at here on how to use telehealth, right? There is a difference in what I would treat via telehealth, right? We think about that. Like I mentioned, we think about pink eye, we think about rashes, right? But when you're saying, hey, I can assess you and then just follow up with either a lab or other things, it really even grows your opportunity of how, when, where, and why to offer telehealth. So I just think that's a great way for all of us to think a little bit outside of how we've used it in the past. And I think some of the other ways, one of my favorite things is hearing from practices and what they do. And so I always get new ideas, but we have practices who use it a lot for lactation, or that do a lot of consulting for adoption and foreign travel. As I mentioned before, those routine follow-ups, whether it's behavioral health or whether it's labs, or we have some practices that are very involved with using nutritionists and weight management. All of those are great opportunities to use telehealth as a follow-up. I had a great example from one of our practices in Florida that's a primary care that uses it for that asthma follow-up, right? To see the environment that that patient is in, and to see that there's shag carpet on the floor. And even though everything they tell you in the office says one thing, it's great to see those follow-ups and see that patient environment. And then again, those virtual sick visits, there's a lot you can assess. There's some you can treat. But it's a great way to start through telehealth. And really, I think the one thing we've learned is adapting for the changing needs, right? And I think Paula really hit on some of the things that when you adapt and you kind of create new workflows, you're going to make this seamless for everybody involved, right? Because that's what efficiencies are about. If it's super efficient for your clinicians, but not for your patients, then you're not going to be successful. Or if it's not easy for your staff, then it's going to be hard to have buy-in from your staff. So encouraging patients to look at how you do telehealth, register ahead of time, making sure they understand, hey, how do I get that telehealth visit if I need one? When is it going to happen? Utilizing how you're already communicating to them. I loved one time I called a practice to ask them a question, and their greeting says, "We now offer telehealth." I was like, wow, that's their communication channel, and they're just adapting that to let patients know what they're doing right now. Let patients know that you have telehealth as an option. And you know what? We all know, and we have a great support team that helps with this, is that even sometimes the most tech parents, or maybe it's just a tired parent, but sometimes you have to talk parents through that using technology. And I can tell you on our support side, those are the happiest, that sometimes maybe just need a little bit of hand holding, but then they're so excited to use telehealth again. So I think Paula did a great job of hitting on this, but I would encourage you to think about, right? We're in another year of crazy times. We don't know what 2022 is going to hold. So think about how you can continue to adapt to meet the changing needs of your patient population and your providers. What are the seasonal visits this year? Is there something we need to do different in the summer? And I think one of the other things I wanted to mention is we have a lot of practices who are phenomenally successful working with summer camps, right? So they work with local summer camps to provide that service of, hey, gosh, if one of our campers is sick, some do daytime, some do away camps. Also, how are you meeting the needs of your college students? Is there a way that you can help meet the needs of those families so that these patients stay connected to that primary care that knows them so well? Because as a parent of college age students, sometimes for them to find care when they're off on their own, when they could connect back to your primary care, like Paula mentioned, they're an established patient. Depending on where you are, there's a lot more leeway for you to treat that established patient, whether they're at home or away at college. And I really wanted to end with this because I think, I don't know, I guess from my practice manager days, is the bottom line is the revenue, right? And so I would encourage you guys to really think about, are you looking at what you're collecting or what you're billing on a monthly basis? Are you comparing this January to January of 2021 to January of 2020 and 2019? Is your revenue flat? Is it growing? We know that there's outliers, right? You can't compare all of 2021 or 2020, but what your revenue numbers should be, because we know it's also seasonal too, right? Your sick visits are crazy in the winter. So I would say, look at your revenue. Also, I think Paula made another great point in that, a lot of our practices have a great relationship with that urgent care to be the extension when they're not available. So if you don't have that relationship, you can build that to make sure that your parents feel like they're always connected to you, whether that's 11 at night, because they know that pediatric urgent care, somebody's going to say, oh, and make sure you follow up with your primary care, right? That quality relationship with a pediatric urgent care can keep your practice, your patients connected to you. And that really goes to, when your patients are walking in the door and saying, I saw someone, do you know where they went? Are they referring them back to you? Did they make a phone call to someone who sent them somewhere else? Think about your bottom line. Think about how you can partner with people to keep your patients connected to you, and how you can really expand your offerings to make sure your revenue is staying in your practice.